Greetings again, welcome and Biomechanical Club channel. Today we are going to do Bolton analysis. Bolton analysis called also tooth size discrepancies. With Bolton analysis, we can measure the discrepancy between the upper and lower teeth. Bolton analysis is divided into two parts. The first part we can call partial Bolton or anterior ratio, and full Bolton. The second part is a full Bolton, and we can say overall ratio. For this analysis, we need a ruler and compass. At first, we measure the mesiodistal width of all teeth, upper and lower, from molar to molar. Partial ratio or anterior ratio, we use from canine to canine, upper and lower, and full ratio or overall ratio, we use the teeth from molar to molar. I measured the mesiodistal width. We measure the easy way by using the compass and putting the two heads, the mesial and distal surface, and we read the number on the ruler. So after measuring the mesiodistal width of all teeth, we have two equations. The first one about the partial Bolton or anterior ratio. For anterior ratio, it's equal sum of upper 6, sum of lower 6 divided on sum lower upper 6 multiplied 100. It must be, for the normal, it must be 77.2%. So this is for anterior ratio. Sum of lower 6, sum upper 6 multiplied 100 equal 77.2. For the full ratio, we use full ratio or overall ratio. Sum lower 12, upper 12 multiplied 100, it should be 91.3%. This is the first equation for the anterior ratio, and this is the overall ratio. For the two ratios, we have the same study or discussion. If if the ratio after calculating this equation, if it's more than 77.5 for anterior ratio, or is more than 91.3 for overall ratio. If it's more than these numbers, so the problem is located in the mandible. If these two ratios, these numbers lower than these numbers, so the problem is in the maxilla. For example, we are going to study this patient, this module. For anterior ratio, we here, I will open the calculator. Okay, 6. Seven plus 7 equals 38. So for this patient, anterior ratio, assume of lower 6 is 38. For upper 6, 10 plus 10, 8 plus 8 plus 9, 54 multiplied 100. So I will do this equation, 38 on 54. It's 70.3%. So if anterior ratio exceed, as we said, if the anterior ratio exceed 77.2, we know that the problem is in the mandible. If anterior ratio is less than 77.2, so we know that the problem is in the maxilla. Here we have 70 and the anterior ratio 77.2. So we have it's less than 77.2. So we know the problem is in the maxilla. How to find the exceed volume? We have here a table for overall analysis and for the anterior analysis. So we have here we have 70.3, so it's less than 77.2. So the actual maxilla minus correct maxilla equals the exits. Actual maxilla, we can find them from calculating the anterior 6. So we have the anterior 6 here, 54, minus correct maxilla. when we know that the maxilla, the problem is in the maxilla, so we assume the lower the mandible is in correct position. So we are looking for the right maxilla number according to this table. We have here lower 6, 38. We are here looking for 30, 38, and the mandible 38. Here, so 38.2. We have here 37.8. We can choose 38.2. The maxilla is 49.5. 49.5. 49.5. So 54 minus 49.5 equals, I have to put there, minus 48.5, 4.5. Uh, 4.5 is the excess volume of the for the anterior 6. The excess volume for the anterior 6. Now we do the overall ratio. Assume of lower 12. We are going to calculate them. 12, 7, 6, 7. 66. 1, 11, 7, 8, 9, 8, 106. 62.2. Actually, the overall ratio 62.2. It's less than 91.3. So the problem is in the maxilla. Actual maxilla minus correct maxillary 12, I mean here 6, that exceed number. So as we did in the anterior ratio, we are looking for the maxillary. Here the actual maxillary is 106. So the correct maxilla, according to mandible 66, sorry, it's not 66. I remade the calculation. It's 88 here. 88. So I'm sorry. 88 multiplied 6. 100. It's 83. 83. So we look for it's still under 91. So 88 mandible 88. It should be 96 maxilla 106 96. So it's 10. The exceed number here in the maxilla is the for 12 for the 12 teeth is 10. Here we know that the exceed number exceed volume for the anterior 6 is 4.5. Here for the overall for the 12. So if we need to know how much exceed volume for the as we say buccal section from first premolar, second premolar and molar for the two sides, we just do this 10 minus 4.5 equals 5.5. So in the maxillary teeth, anterior teeth, we have exceed volume about 4.5, and the posterior teeth for both sides, we have exceed volume for 5.5 millimeter. For 5.5 millimeter. This is the Bolton analysis and how we do it. So for finishing, we calculate the lower 6 and upper 6. Then we calculate the volumes of lower 12, and for upper 12, we do anterior ratio, assume of lower 6 here, assume for upper 6, multiply 10, it should be 77.2. If the anterior ratio exceed the 77.2, so the problem is located in the lower teeth. If it's less than 77.2, is the problem is located in the upper. Overall ratio, we do the same. Lower 12, upper 12 multiplied 10, it should be 91.3. If the number here is exceed this number, so the problem is located in the mandible. If it is less than this number, so the problem is located in the upper 12. We do the calculations here from the table. We look for the correct maxilla. In this situation, we look for the correct maxilla volume according to the mandible located in the anterior analysis or the overall analysis. So, and for the overall ratio, we do the same. And finally, we find out the exceed volume for the anterior and the posterior section. Here in this situation or this case, the exceed number of volume of the anterior 6 is 4.5 millimeter. And for the posterior, for overall ratio is 10. We find out the posterior section for two sides is 5.5. That's all. Thank you for watching. Welcome in the biomechanic channel.